they do private.
Thanks, Chair. And Angela, I want to follow up on your remark about rooms being just rooms with furniture if we don't have the healthcare workers to staff them, because while we have this incredible backlog and long wait times for care of all kinds that the government says requires us to move to a private for-profit model of care, we have operating rooms in Ottawa, at the Ottawa Hospital, at the Queensway Carleton Hospital, that are not being used, that are definitely not being used around the clock, but in some cases are being seriously underutilized because we don't have the nurses and healthcare workers to staff them. The government says that means we have to go private, but my fear is that having this competing private system is going to draw our nurses and healthcare workers out of the public system. You've mentioned agencies being able to pay higher wages to nurses and that being an attractive option. Well, now here's an option outside of the public healthcare system with better working conditions. That's going to be drawing nurses away if the government is not actually prepared to address wages and working conditions within the public system. Is that also your fear with this privatization plan?
Absolutely. Absolutely. We are currently looking at being one of the lowest start rates in the country for registered nurses. We need to be competitive. We need to have competitive compensation to draw back nurses who are leaving this province. And the private sector to take over nurses outside of the public sector, it's just going to be a greater war zone than it already is.
And is there a magical pot of healthcare workers and nurses that exists that the private sector can draw and that the public sector is not able to now?
Of course not. They're just going to suck them out of the public system, right?
Exactly. Thank you.